Hey, Dr. Fischer here again to answer some of your most frequently asked questions about COVID-19 vaccination. So one question I frequently get from my students and other students across the Detroit Mercy campus is, I have no pre-existing conditions. What is the point of me getting vaccinated? Isn't this only a problem for people who are already sick or have an underlying issue? Well, there are a number of reasons that you should get vaccinated even if you're young and healthy. One of the most important things is to break the chain of infection. If your immune system can respond, if you're exposed, it can stamp out the virus before you become contagious. Even in the case of a breakthrough infection, the people who are vaccinated shed virus for a much shorter period of time. This will help protect your friends and all of those around you. Also, as a Jesuit and Mercy institution, one of our core values is to protect the vulnerable. You might have elderly people who are important in your life. They're very vulnerable to severe COVID, and vaccines just aren't as effective in older people. So protect your parents, protect your grandparents, maybe your older professors, family, friends, mentors, groups like that. Also remember, at this time, children cannot get vaccinated. You may have kids of your own. You may have nieces, nephews. Keep an eye out for them, protect them from illness as well. Also, there are people who cannot get vaccinated even though they want to. They would like to protect themselves, but they're unable to do so, maybe due to an allergy or certain reaction. So if you can protect yourself, you can help protect them. Also, the vaccine might not be as effective in people who have conditions that suppress their immune system, such as cancer or other diseases. Also, if you're young and healthy, it may have been a long time since you've been to the doctor, and so you might have a pre-existing condition and not even know about it. You don't want COVID to be the thing that makes you realize that you actually do have some underlying condition. Also, even mild infections from mild COVID cases can lead to long COVID. There can be complications such as myocarditis, there can be lung damage. People have talked about experiencing brain fog for several months. There can be shortness of breath that lasts for an extended period of time. I know people who have had lost their sense of smell and taste for several months, and that really takes a lot of the enjoyment out of life if you can't enjoy your meals. Also, you're going to be studying hard this semester. A lot of people who have had COVID report difficulty thinking or concentrating. Is also known as brain fog for several months at a time. Also, in the worst cases, you might have been on a ventilator or in a hospital. If you've ever seen someone on a ventilator, it's a very traumatic experience. And I would encourage you to take a look at a video to see what this really entails. Also, over 2,500 Americans in their 20s have died from COVID-19. This isn't just a disease that affects the older population. So again, on a positive note, I do encourage you to get your shot, stay safe, stay healthy, and have a great semester. Thank you.